we are having so many of our children who are being misdiagnosed as having meningitis, who are being misdiagnosed as having malaria, and they are dying undiagnosed at the periphery with brain tumors. And they could not have been referred early because the person who was managing them thought that they were treating a malaria. The purpose of the Pediatric Haemato-Oncology workshop is actually to broaden the awareness of health workers within KNH and especially within the pediatric department, and by extension other facilities within the country, and just to continue creating that awareness. Because again, one of the challenges is that awareness, that people still don't believe that childhood cancer is actually common. It is not always malaria. It is not always meningitis, especially if you are managing something which seems not to be responding. There's a possibility that you can refer this child early and they can be picked early and you can start management early.